In 2017, U of M launched Precision Health as a presidential initiative, really capitalizing on advances in data science, big data management, genetic sciences, and other biomedical sciences, where researchers all over the world are really entering this space to enhance how we care for patients.
We were one of the first universities to really invest deeply in this space, and I think that that's been a really important piece of our work. Many universities have also invested in the idea of precision health, but I think that at Michigan, this program sits actually as a cross-school collaborative.
The University of Michigan, at least in my experience, is a very interdisciplinary place where there's very few boundaries between different departments and between different schools, and it is very easy to form these type of interdisciplinary groups that allow this type of research to be at its maximum impact.
So U of M isn't just the right place, it's the perfect place for this type of work to flourish. In addition to our breadth and our depth in research capabilities, we also have this culture of supporting multidisciplinary research and collaborations, and more importantly, we enjoy working with one another.
We very early focused on developing the compute environment and the analytic capabilities, as well as the data collection, the data cleansing, the data access. And so that was a huge undertaking. We also focused our work in developing our cohort. A lot of people have biobanks. We had a biobank, the Michigan Genomic Initiative, that we wanted to expand and increase and enhance in a number of ways, including diversity of ethnicity and diversity of disease.
So I think that Precision Health has done a lot in the last 5 years. We've really established, I think, a wonderful system for collecting data at scale across populations. We've also created a method for us to be able to curate this data and then make it available broadly to researchers across campus so they can ask really novel and important questions.
Precision Health is in a very good place. We have an amazing data set that is very rich and provides opportunities that are very unique. We can combine that with a highly trained, highly competent support staff that can help researchers at Michigan to set up their research. And all of this is guided by an enormous amount of scientific expertise that can help us grow this data set in the directions where they are most beneficial to researchers.
The most meaningful collaborations that I've seen in my role as co-director have been those that have spanned multiple departments, multiple schools, multiple colleges, where researchers come together around a shared vision, but at the end of the day, there's something in it for everyone.
Another major collaboration was understanding the genetics of COVID risk. Having the University of Michigan Biobank allowed us directly to identify individuals that had gotten infected with COVID and compare their genetic profiles with individuals who had not gotten infected with COVID, and thus identify which genetic factors were underlying the genetic risk.
Where we were able to also act rapidly is the development of discovery around how pulse oximeters, which are tools that we use at the clinical bedside each day to measure blood oxygen saturation. Pulse oximeters may actually have some bias towards certain types of skin colors. Darker skin colors seem to cause effects in terms of how the device reads, and that can actually have clinical implications.
When we started Precision Health, we knew that for it to be successful, it really had to depend on multidisciplinary collaborations with scientists from the biomedical sciences to the engineering sciences to the social sciences. And we knew if we could form those type of collaborations, we would be able to enhance patient care.
I think we have spent the last 5 years building phenomenal infrastructure, and we have resources now. We can still expand those resources, and in particular focus on the diversity of the cohorts. In addition, really work on implementing or translating our findings, our discoveries, to the bedside. So that's where I'm really excited about seeing progress in the next 5 years.